Hi, my name is JOSE Sanchez. I am the president and CEO of Humboldt Park Health on the website of the city of Chicago. Approximately 4 years ago, we decided to change the name of the hospital because it didn't really represent the ethnic composition of the patient that we were seeing. We actually brought together a consulting firm and we brought staff, people from the community, to advise us on how to change the name. There, we actually changed the name from Norwegian American Hospital to Humboldt Park Health. During that process, we actually exercised a number of ideas at that time. And one of the ideas was that we wanted to really honor the community of Humboldt Park. We also wanted to honor the park. And we also play with the colors. So the green color actually is honoring the community of Humboldt Park, but honoring the park. We used the blue, which was the traditional blue that the hospital had, and we kind of blended together to create this composition of green and blue to honor Humboldt Park, but also to keep the tradition of the hospital that had been here for more than 130 years.
Hello and welcome to Dr. VGP's podcast that reaches 42 million households around the world, including 2 million across North America. In 1969, a 15-year-old Puerto Rican boy arrives in New York. And then today, in 2026, he opens a state-of-the-art $30 million wellness center in the heart of Chicago's Puerto Rican neighborhood. Meet Jose R. Sanchez, an angina in healthcare and beyond. Welcome, Dr. Jose Sanchez, to our show.
Thank you.
Thank you so much for joining us today. And there's so much to share about your vision, your history, and how you are revolutionizing healthcare today in Chicago and beyond. Tell us about your early childhood.
I was born in the small island in the Caribbean called Puerto Rico, and I moved to New York City at the age of 15 and a half. I actually moved from the island to live with an uncle. And then from there, I actually lived with an uncle, and I put myself through school, finished high school there, and also college, and I went to graduate school there. In my early days in New York, I lived in a very tough neighborhood, and to stay out of trouble in the community, one of the things that I did was I volunteered in a psychiatric hospital to really socializing with individuals who were suffering from mental health conditions. I guess that was my beginning of introduction to be in healthcare, and I am 40 years later in the field of healthcare, and I never left.
Chief, today we have the honor of hosting you. You are an institution by yourself. And as the CEO of Humboldt Park Health, you have revolutionized healthcare, being an embodiment of change, innovation, prevention. How did this concept of the $30 million wellness center come to you, and how did you achieve it? It's in such a short span of time. Could you tell our viewers?
Well, let me tell you, my years in Harlem, Central Harlem and East Harlem in New York City got to understand and learned the suffering of individuals in poverty, that they didn't have the best health care, but also they didn't have amenities that they could enjoy like other most affluent communities. So the idea was to bring health and wellness to a community that did not have the opportunity to have the level of respect and decency to be in an environment that is welcoming, that actually welcomed them. And I have to tell you that this was a project that it took me approximately 7 years. Became a concept, have no dollars to actually build this. Then I began to lobby in Springfield to elected officials, and also getting the support for the community to begin to get the funding that we needed. This wellness center is a $30 million project. It's a combination of funding that came from the state and also from the city of Chicago, and also dollars that were allocated by the board of directors of the hospital. To date, we are sitting probably in the most transformative center in our city right now. And our design of this building,
Yes.
which actually is consistent with the change of the name of the hospital, as you could see, the panel structure is actually also resemble the community and honor the park and the community of Humboldt Park. So this was a design that actually worked perfectly for everything that we were trying to do, transforming healthcare in our city of Chicago, bringing a project that people would never would envision that they were going to have. And I joke around and I say to people that this wellness center is actually better than those in the east side of our city, where the most wealthy people live.
You're absolutely right, Chief. Tell us about the Norwegian American Hospital, how you transformed it to Humboldt Park Health today, and the history of the Norwegian American Hospital.
Right. Well, this hospital was actually founded back in 1894.
Wow.
And actually served many different groups that established themselves in this community. But the hospital was established and founded by a group of Norwegians, and actually began with a small clinic, and they expanded into a hospital. Then they put emergency department. If you look at the building, it has pieces of different, all connected, that came at a different time during the process of building a hospital. So in 2010, the hospital actually was just about to close. I was called from New York to turn around an organization that has a history in the community, but actually was just about to be closed. I came in, I focused in 5 areas. I didn't get distracted. So I wanted to recruit doctors. I wanted to really focus on quality. I wanted to focus on financial stability. I wanted to focus on technology, which at the time that I got here, there were no electronic medical records. But also, I wanted to establish a presence in the community.
In the neighborhood.
Because this is the hospital. This hospital belongs to the community of Humboldt Park.
You said it very well, Jose Sanchez. As CEO of Humboldt Park Health, you not only manage the healthcare institution, but you're driving a mission of equity, of healthcare access, and making it community accessible. Tell us, what is one big point so far in your 15-year-old career here in Chicago, apart from the wellness center?
Well, I mean, I inherited a hospital that was just about to be closed, and actually bringing something from the ashes to build what we have today. So Humboldt Park Health today stand out as one of the most successful safety net hospital, the gold star hospital, as some healthcare leaders call it, and being able to create an institution that actually has the technology competing with everyone. It has the quality that actually is expected, and is financially stable. All of this in synergy actually have worked to create an incredible institution for the people of Humboldt Park, but also having people that work in the organization that have the same commitment, they have the same cultural values, and resemble the community. So we are very successful, and I am so happy that we are where we are today.
Yes, you have been featured recently on the cover of the prestigious Hispanic Executive magazine, and you have transformed healthcare. You took a hospital which was closing down, made it one of the most prosperous, one of the most technology advanced healthcare institution in Chicago, and you've gone a step further, not only treating the patients, but you want to go preventive care. And we are sitting here in your brainchild, the Wellness Center, which has the best of best, and it treats all ages, from seniors to children. You have a roaring health club, you have a swimming pool, you have exercises, you have yoga classes, you have nutrition classes, you have a terrace garden. You can go on talking about your vision, which you brought to life. I mean, that must be a very satisfying moment for you. You're also the president of the Safety Net Hospitals of Illinois, Chief Sanchez. But today, the healthcare around this country is going through a lot of challenges. What do you think is absolutely necessary for us to get back on track?
I think that we need to really focus on quality. We need to really focus on prevention and education. I think that there has been significant disinvestment in poor communities around the country. And I think that we need to begin to think about putting the dollars that we need in those communities, but also beginning to develop a new model of providing care that is not only health care. One of the biggest problems and the biggest challenge that we have had in our country has always been that the services that we provide in hospital are pretty much isolated, very concrete. We only provide healthcare, but the wellness of any individual is also related to other factors that is not health care.
Absolutely.
It is about food. It is about the housing, where they lived. It's about safety. It is about an education. And it is about working together with different sectors to really create a model that actually bring together all of the services to create the healthy individuals that we want in our society. So I'm looking forward to continue to work with every stakeholder to create a better world and create better health for everyone in our country. And I got to tell you, the opportunities that we have in this country are tremendous. We are the richest country in the world. We have the best scientists in the world. We train the best doctors in the world. We got the best technology that you could find in the world. We have the best university that you could find. And now we can produce better outcomes for the population that we served.
You're absolutely right, Chief. What does health equity mean to you with the today and the real day, everyday impact?
Health equity for me really represents having equal access and providing the availability of services to anyone at the same level, no matter how what level of education you have, what is your financial status, but is able to create a system that actually serve everyone equally. I served on the Illinois Hospital Association Health Equity Committee. Our goal is to ensure that we represent and are the voices for individuals in our society that do not have equal access in the country, in the state.
Your success story of how you've led Humboldt Park Health to be one of the foremost healthcare institutions in the neighborhood and beyond. Tell us, what is one misconception about community hospitals the people have that you would like to clear up, and why?
I think the misconception is basically that there is a lack of education, of understanding the populations that we served. For example, the population that we serve in safety net hospitals is pretty complex. We have individuals that are suffering from chronic health conditions, individuals who are in poverty. Many of them, they lived in substandard homes. Just to give you an example, 37% of the population that lived in Humboldt Park are below the poverty line. That's significant.
Absolutely.
You know what that really means? That oftentimes you live in substandard home, that you do not have choices to eat what is healthy for you, that you don't have a place to exercise, that you oftentimes focus more on surviving than actually take care of your health. That's exactly what that really means. People don't understand that.
And you have taken it one step further. You've opened up this wellness center and you have broken even and made a profit in 7 months. You have 2,300 people using the center every week. It's buzzing with activity. And I mean, you have really shown what it takes, the other step. You're just not waiting. You want the population where you are providing service to be healthy. and to least use your dose. Having said that, today in healthcare, we have AI, data and telemedicine, artificial intelligence. What is that excites you most in this era in healthcare delivery?
Well, I think that technology actually help us to be much more efficient. But I think when we take a look at some of the AI projects that we have here on the way, we have a concierge application that patient actually called and they select their appointments without having any conversation with anyone. We also have another application that actually kind of select the conversation of physicians actually and actually take out those things that are not relevant for their health. We also have an application for assessing someone who have a stroke. So there are multiple AI applications that are up there that we are using for the benefits. We want our doctors to really spend time with the patients to understand our patient health conditions. And AI is helping us to really create that environment where not any longer doctor has to be typing and taking notes. Actually, they could be in a room talking to a patient, asking questions, and those questions are actually relevant or not relevant for the note, and the AI is able to type the note that is relevant to the health of the individual.
So that's improving healthcare for the patients, delivering it faster. And how is the recovery rate? What does the AI play a role in the actual patient care?
I think that the recovery is that we basically spend more time in treating patients rather than actually in what we call in healthcare bureaucratic documentations.
Correct.
That at the end of the day, of course, it is beneficial, but human beings wanted to talk to someone that actually understand them, and for example, in the Latino community, if you think about the doctor relationship with the patient, it's very different than most people. When a Latino patient is going to a hospital, he or she will say, I'm going to see my doctor. You know what I really want?
They personalize.
My doctor is my doctor. And doctors become part of their family.
Correct. You're absolutely right. Have you ever thought of, Chief, having a healthcare leadership institute as part, you said during the daytime here in the Wellness Center, with all your experience, inviting young Latinos who will be interested in leading healthcare like yourself, becoming CEOs, having a hands-on practical, maybe a weekend or once a week course or a program, put all your efforts, what you have learned in New York, what you have learned here, and particularly culturally sensitive, like you just pointed out the Latino community. Have you thought of putting it into a formal course and being the first healthcare executive hands-on, passing on the skills you have learned to the next generation and even to the current CEO crop? Because healthcare is so much evolving, the managed care organizations are taking away. I would like to have your take on that after this question.
Well, I got to tell you that you're spot on that issue, because I think our communities actually lack role models.
Absolutely.
That actually will bring the young generation to think about in a career in healthcare. Having a conference to talk about that, I think is a tremendous idea, but also of a great benefits to hear. And I got to tell you one thing. I got 4 priorities in my career today. Number 1 is to stay healthy. And that requires, basically, eat healthy, exercise like I do every day, and I recommend everybody to do that.
You look picture perfect fit, and your dressing sense is beyond. You should be on the Gentleman's Cover magazine.
Thank you.
You have to learn how to dress.
The second one is to take care of my family. I have a daughter, 2 grandchildren that actually are dear to me. Number three is basically to really create an impact in healthcare beyond the city of Chicago and the state of Illinois, and that's consistent with what you're saying. And fourth, my fourth priority is to be a mentoring the next generation of healthcare leaders in the country that will take over people like me who are actually going to just bring the knowledge, but you need someone to have the energy to run, that have idea, that have a different vision to create a healthier world.
You couldn't have said it better. You just met Jose Sanchez, an enigma in healthcare, as I call, not a phenomenon, an enigma, an institution of himself, who wants to part all the skills and success and visions to anybody who would like to think. And I would like to partner with you in getting that message across the globe, Chief. And we should start it this year. You know, we should have the Jose Sanchez classes in healthcare leadership, a special course to treat, especially people like us of color. You know, we should be in leadership positions. We should tell our youngsters and our generation, here is what you can do. You have a hospital, you have a wellness center, and you can have them hands-on training, you know, and give you, and part and share with your leadership skills. What would you like to have Humboldt Park Health's legacy? What you have worked near-shutdown hospital to one of the most successful hospitals today, serving the inner city of Chicago. What do you think would be, what, in your opinion, you have a vision, you have a mission, Humboldt Park Health's legacy? What would you like it to be?
So right now, we have been able to stabilize the hospital and we have been growing, but there are areas that are important to me for this community. One is we need to continue to address all of the social determinants of health.
Yes.
Food insecurity, transportation, housing. And right now, I have a project on the way of building 48 units of affordable housing in our campus. So right now, I'm looking for the funding that will be required. You know, my life has always been about having a vision and thinking about something and without having any money, because, you know, sometimes money is not that important to have a vision and stay focused and get it done. This building here was just another example of a concept, an idea, and actually identifying the strategy to get it done. My housing project will be done.
I'm sure it would be.
And I expect that this will be completed maybe within a year and a half, 2 years, and then we will continue. The master plan development for the hospital called for 300 units of affordable housing.
Fantastic. And it'll be all surrounding in the neighborhood?
All surrounding, also with the same architect, with the same design, the same material, to brand Humboldt Park Health at that institution that brings all of the infrastructure and the building that people will say, that's Humboldt Park, that's Humboldt Park, that's Humboldt Park.
So you'll have a Humboldt Park township, a mini city within a city.
Absolutely.
Fantastic vision. And it's going to be an affordable city, city which provides all the amenities and also the state of art, which I can see it happening. Chief, if you're given an opportunity to take 3 people out for dinner from the past to the present, who would they be? They could be your mentors, your heroes. Just to give our viewers about your mental makeup, you're being an institution yourself. You're a one-man machine. What drives you every day?
Well,
who are the 3 people? Who are your heroes?
Who are my hero? I spend a lot of time focusing on leadership. Who are my leaders? You know, and they don't have to be in healthcare, but there are people who accomplish something and create an impact on the world. So for me, I could see someone would love to learn more about technology. I could take a Bill Gates out.
Bill Gates, okay. Dinner, okay.
Actually, to dinner. I will take a politician out to dinner, a president that I think I admire for his courage and he's able to manage the world. Ronald Reagan.
Great.
I will take with me. And when I talk about healthcare, I think that there is a man from New York that actually run can't recall exactly their healthcare system, who is also a social worker who is kind of very successful there, but and I can't remember the name of right now. That will be someone that I will kind of take. But also, when I was growing up and I was going to school and college, there was a professor, Richard Skolnick, who actually identified me and says to me, "What are you going to do in your life?" And that professor actually gave me that idea to keep going. Michael Dowling from New York healthcare system will be someone that I will take forward.
You just heard the phenomenon Jose Sanchez saying 3 heroes. One, he would like to take Bill Gates out for dinner. Ronald Reagan, president, I served under him as the health commissioner, first colored for Native American health. And I continued under the next President George Bush. So he was a wonderful president. And also Michael Downing, a New York social worker, and Ronald Sturnick, one of his professors who made an impeccable mark in Jose Sanchez's life. Chief, if you have done so much, and in 3 words, how would you describe yourself? Or 3 adjectives?
Persistent.
Persistent, good.
Okay. Determined.
Determined.
And no fear.
Wow. You just heard Jose Sanchez, the great, persistent, fearless, and no fear. What was the third one, Chief?
No fear, persistent, focused, just...
You just heard him say that, focused, persistent, and no fear, fearless. And he makes things happen in reality. And now, really tell us how many cups of coffee it takes to run a hospital and in your life. Do you drink coffee?
Well, I got to tell you I drink one strong Latino Puerto Rican coffee in the morning.
Okay.
Café con leche, coffee with milk.
Okay.
Right? But I think my energy really comes from, I get up about 5:15, 5:30 every morning.
Wow.
I go to the gym about 5:45, workout, and then I come to work.
You have a regime.
So I actually have tremendous energy early in the morning, right?
Right.
And then around 3 o'clock, I'm beginning to kind of going down, and then after that, I will pick up again. And then I won't be able to sleep at night.
Wow. So it's only the magic recipe is 1 Latino cup of coffee with the latte in it. And that's what here, you're going to hear much more of Jose Sanchez and the wonderful things he's doing at Humboldt Park. Watch out in our channel here. We're going to have lots of great things happening for this wonderful person. In the last winding up this interview, Chief, could you tell our viewers your message, whatever you want to share with them about what life is, what awaits them, and what they should do? You are a perfect example in everything that you do. And now you can just talk directly to our viewers as we close this interview.
Well, as a migrant coming from the island and not actually understanding that I never going to be an American, and learning a different culture and also learning a different language, it is being persistent, it is working hard, it is about doing the right thing for people. And if you want to last long, please find something that you really like in your life. Because if you do something just for work, it doesn't work. It has to be something that you love and you have a passion for it. I love healthcare. I have a passion for this. I am never tired. And there are no hours of the day that I do not work because I love it. And people ask me, when are you going to retire? I think you guys are going to see me for a very long time.
Wow.
Out here.
So, it's been so wonderful having you on our episode, Dr. VGP Podcast, in awe of your energy, your dynamism, your vision. And I'm sure Humboldt Park Health and Humboldt Park neighborhood is going to be changed to a luscious green, like you explained how you brought about. And wishing you all the best, as this institution, 30 Million Wellness Center, is up to get the first prize in architectural design. I mean, that makes you feel real proud of all your hard work and sweat which went into this. And we're looking forward to the affordable housing coming up, and the Humboldt Park Green next project, which is already in the works. And I'm sure that the best is yet to come. 5 years from now, where do you see Jose Sanchez, the phenomenon?
5 years from now, I'm going to continue to do what I'm doing, which is try to really focus on improving the health of every citizen in our country. They deserve it. I always tell everyone that there are 2 ingredients for a successful person. 1 is to be healthy. 2nd is to have an education. I'm not talking about money. Those 2 things are key to a healthy society.
Sir, you hit a right point. You talk about citizenship. Today, with all what's going on, what will your message be to the immigrant communities of America? Are we safe in America?
I think that there will be a period of time that there was going to be a level of stability. I don't think that pain lasts for too long. I think that this period of time will be over, and we have an opportunity to interact, to live without fear in the country. I think we're going to be able to continue to grow and develop ourselves. And for the immigrants community, stay focused. Do not lose hope. There are still tremendous opportunities that exist. And don't go anywhere. Stay here. Our country needs every immigrant to make a great society.
Wow. What a wonderful concluding message for all of us, which gives up hope to stay in this great country, and there's hope alive for each of us. Thank you, Professor Jose Sanchez, for joining us and for your life. And may you continue to conquer not only Humboldt Park, Chicago, and rest of the world. It was wonderful having you on our episode today.
Vijay, thank you for having me. It is a privilege to be in your show. You have done tremendous job. I mean, you got viewers all over the world, millions of people, and that attests to your commitment to the work that you do. And to me, it's an honor, humbly, to be here in front of you and being in your show. And I hope that people continue to support you.
Thank you.
And follow you, because every topics that you take actually is for the betterment of our society.
Thank you so much. We owe a great debt of gratitude for your leadership, and may you continue to conquer the world. Thank you.
Thank you.
Hello and welcome to Dr. VGP Talk Show.
Fusion Systems and Services, a powerhouse in innovation, delivering transformative technology solutions. With our groundbreaking cloud-ready product, ITIS, leading the industry as the ultimate RPA solution, trusted by top global enterprises. From mobile application testing to middleware automation, from big data integration to SAP automation, and even Salesforce automation, Fusion Systems is your strategic partner for success. No challenge is too big. No system is too complex. Empower your business with Fusion Systems. Visit us now at fusionsystems.inc.com and revolutionize your future.
Welcome to the future of medical science. At Soft Landing Labs, we go beyond the basics of drug confirmation and quantification. Using advanced LC-MS/MS technology and our own proprietary software, we deliver accurate, fast, and meaningful results. We're the only lab offering color-coded reports and a web platform with medication tracking and drug trail interpretation. Our personable professionals, ethical practices, and 24-hour stat testing mean you're never left waiting. From doctor shopping alerts to provider video support, we've thought of everything to help you stay compliant and informed. Soft Landing Labs, accuracy, innovation, care. Soft Landing Labs, your trusted partner for drug-free communities.
MedStar Laboratory is one of the oldest and largest independent clinical laboratories in the state of Illinois.
MedStar Laboratory is a minority-owned corporation that provides state-of-the-art clinical laboratory services since 1974.
Currently at MedStar, we service over 800 medical facilities, including hospitals and assisted living facilities.
MedStar Laboratory's toxicology division, Soft Landing Labs, is a leader in drug testing and specializes in servicing behavioral health centers. We pride ourselves in diversity, where 33% of the ownership is women and 80% of the workforce is women. MedStar Laboratory prides itself in accuracy, proficiency, and dependable delivery of quality results by quality professionals.
We provide personalized service around the clock, 24 hours a day, 7 days a week, with professionalism at its best.
Thanks to you, we are growing and offering a comprehensive range of diagnostic testing. MedStar Laboratory, your partner for progress and longevity.
At MedStar, we treat every specimen as if it was our own.
Dear viewers, elevate your business to new heights and reach 35 million potential customers with Global Eye Digital. Contact us today at globalidigital@gmail.com or info@globalidigital.com. Let's take your business global.